If your dog is a large breed, listen closely. There's a condition that can kill a completely healthy dog in under 2 hours. No warning, no illness first, just a normal dinner, then a crisis. It's called GDV, or bloat, one of the most time-critical emergencies in veterinary medicine. Today I'll show you exactly what it is, which dogs face the highest risk, and the early signs almost every owner misses, and precisely what to do if you ever see this happening. GDV stands for gastric dilatation volvulus. Dilatation means the stomach fills with gas and stretches. Volvulus means it actually twists on its own axis inside the abdomen. When that twist happens, everything turns catastrophic very fast. Think of the stomach like a balloon with a hose attached at both ends, the esophagus coming in, the intestine going out. When it twists, both connections get pinched shut. Gas building up inside has nowhere to escape, so the stomach keeps expanding like a balloon with no valve. Here's why the clock matters so much. As the stomach twists, it also twists the blood vessels feeding the stomach and spleen. Those vessels pinch shut completely, and stomach tissue starts dying from lack of blood flow. The swollen stomach presses on the diaphragm, making breathing harder. It compresses a major vein, causing blood pressure to crash. The heart struggles to pump, and toxins build up in the bloodstream. And within a couple of hours, a completely normal dog can spiral into full-blown shock. So who needs to worry about this? GDV overwhelmingly affects large, deep-chested breeds. Great Danes carry the highest risk in most studies, followed by standard poodles, German shepherds, Weimaraners, St. Bernards, and Dobermans. Beyond breed, other factors matter too. Older age, eating one large meal instead of smaller, frequent ones, fast gulping eaters, exercising right after meals, and a genetic link. Since a dog with a parent or sibling who's had GDV carries elevated risk themselves, here are the early warning signs. Pay close attention here, because early GDV signs are subtle and easy to dismiss as a simple upset stomach. Catching them in this window is often what separates dogs who reach surgery in time from those who don't. The first warning sign is often restlessness. Your dog may seem unable to get comfortable, pacing around the room, lying down, then immediately getting back up. This isn't normal nervous behavior. As the stomach begins to fill with gas and twist, it creates intense internal discomfort. Your dog knows something is wrong, but can't find a position that eases the pain. Notice the repeated pacing and inability to settle. This is often one of the earliest warning signs of GDV. The next warning sign is repeated dry heaving. Your dog looks like they're trying to vomit, but little or nothing comes out. This is one of the most classic signs of GDV. Because the stomach has twisted shut, nothing can escape, even though the body keeps trying. Repeated dry heaving with little or no vomit should always be treated as an emergency. Many dogs also begin drooling excessively, even if they normally don't. Pain, nausea, and the inability to swallow normally cause saliva to build up. Heavy drooling together with restlessness or dry heaving is especially concerning. Excessive drooling may seem harmless, but alongside other symptoms, it can be an important early clue. As gas continues building inside the trapped stomach, the belly may begin to look swollen or feel unusually tight. In some dogs, the swelling is obvious. In others, especially deep-chested breeds, the bloating can be subtle at first. Never wait until the belly becomes dramatically enlarged. Even mild abdominal swelling can signal dangerous pressure building inside the stomach. If you see any of these signs, don't wait to see if your dog gets better. This is a medical emergency. Get in the car and head to the nearest emergency veterinary hospital immediately, even at 2 a.m. Even on a holiday, even if the drive takes an hour. Every minute matters. As pressure inside the stomach keeps rising, the abdomen may become swollen and feel hard, almost like a drum. This isn't normal bloating. It's a sign that dangerous pressure is building inside the body. A hard, tight belly means pressure is rapidly increasing inside the stomach. If your dog repeatedly tries to vomit but nothing comes out, treat it as an emergency. This is one of the most recognizable warning signs of GDV. Repeated dry heaving with little or no vomit should never be ignored. As shock develops, blood is diverted away from the gums and other tissues. Healthy pink gums may turn pale, gray, or even white, and they may feel cool to the touch. Pale gums are a sign that your dog's circulation is beginning to fail. As blood pressure drops, your dog may suddenly become weak, stumble, or even collapse. This means vital organs are no longer receiving enough oxygen. Collapse is a life-threatening sign of severe shock. As oxygen levels fall, dogs breathe faster and their heart races, trying desperately to deliver blood to the body's organs. Rapid breathing and a racing heartbeat are signs that your dog's body is struggling to stay alive. The moment you recognize these symptoms, stop searching online and start driving to an emergency veterinarian. GDV is one of the few conditions where minutes truly save lives. Research consistently shows the same pattern. The sooner a dog reaches emergency surgery, the better the chance of survival. Delaying treatment, even by a short time, can dramatically reduce those odds. The fastest decision you make may be the one that saves your dog's life. To understand why GDV is so dangerous, it helps to picture where the stomach sits inside your dog's body. Normally, it's a J-shaped organ tucked just behind the rib cage, connected to the esophagus at one end and the small intestine at the other. In GDV, the stomach rotates on itself, sometimes 90 degrees, sometimes 180, and in severe cases, a full 360 degrees. Once that twist happens, both ends of the stomach become sealed shut. Normally, food and gas can move freely through the stomach and into the intestines. As the stomach fills with gas, it can rotate like a balloon twisting on itself. That twist blocks both the entrance from the esophagus and the exit into the intestines. Once the stomach twists, nothing can get in and nothing can get out. Because both openings are sealed, swallowed air and stomach contents become trapped inside. That's why dogs with GDV repeatedly try to vomit, but produce little or nothing. Gas continues building, but it has nowhere to escape. The stomach and spleen are connected by strong ligaments and shared blood vessels. As the stomach twists, it often drags the spleen with it, making the emergency even more dangerous. The twisting stomach often pulls the spleen out of its normal position. As the twist tightens, it squeezes shut the blood vessels supplying the stomach and spleen. Without oxygen-rich blood, these tissues begin dying within hours, while the trapped pressure pushes the rest of the body toward shock. This is the turning point when trapped gas becomes a life-threatening loss of blood supply. And that's why GDV is far more than simple bloating. It's a rapidly progressing emergency where trapped gas, blocked blood flow, and organ damage are all happening at the same time. The only effective treatment is emergency veterinary surgery. And that's why GDV is far more than simple bloating. It's a rapidly progressing emergency where trapped gas, blocked blood flow, and organ damage are all happening at the same time. The only effective treatment is emergency veterinary surgery. GDV does not resolve on its own. It only progresses, often quickly. Early on, a dog might bring up a small amount of foam before the twist fully seals shut, so one vomit never rules anything out. Trust your instinct and act on it. I want to be direct here, because dangerous advice floats around online. Do not try to induce vomiting. It won't work. The stomach is sealed shut. Do not give food, water, or medication by mouth. None of it can reach where it's needed, and it can complicate anesthesia if surgery follows. Do not press or massage the abdomen. It can cause serious internal damage. Once you see emergency signs, the only correct move is immediate transport to a vet. Once you arrive at the emergency clinic, the team immediately treats shock, placing an oar catheter and starting aggressive fluids to support blood pressure. They'll often relieve pressure by passing a tube or using a needle to release trapped gas. This buys critical time while they prepare for surgery. X-rays confirm the diagnosis and the degree of the twist. Blood work checks how the shock has affected organ function and guides safe anesthesia. Once stabilized, your dog moves to surgery. In surgery, the team carefully untwists the stomach and thoroughly evaluates the tissue. If sections of the stomach wall or spleen show permanent damage from lost blood flow, those portions may need to be removed. Then comes gastropexy, a critical step where the surgeon permanently tacks the stomach wall to the inside of the abdominal wall so it physically cannot rotate again. This dramatically reduces the chance of GDV ever recurring, even if bloating happens again later. Recovery is a process, not an overnight event. Most dogs stay hospitalized several days after surgery for 4 fluids, pain management, and close heart rhythm monitoring, since abnormal rhythms are a known complication after GDV surgery. Once home, expect 2 to 4 weeks of restricted activity, plus a gradual return to a bland, easily digestible diet before transitioning back to normal food. Most dogs who survive surgery and the critical first 72 hours recover very well. This is one of the most common questions owners ask, and it's a fair one. Without gastropexy, dogs who survive one GDV episode have a genuinely high recurrence rate, since the stomach is simply prone to twisting again. But with a proper gastropexy performed during surgery, the recurrence rate for another full twist drops dramatically, down to low single digits in most studies. That's why gastropexy is treated as a standard part of surgery, not an optional add-on. Now let's talk prevention, backed by real evidence, not internet folklore. Feed 2 or 3 smaller meals a day instead of one large meal. Use a slow feeder bowl to limit how much air and food your dog gulps at once. Avoid vigorous exercise for an hour before and after meals. Only use elevated bowls if your vet recommends it, since raised bowls have been linked to increased risk in some studies. For high-risk breeds, ask about a preventive gastropexy, often done alongside a spay or neuter. Remember this, GDV is a race against time, and you are the first responder. A restless dog, dry heaving with a firm swollen belly, needs an emergency vet immediately. Don't wait to see if it improves. Talk to your vet about your dog's individual risk and whether a preventive gastropexy makes sense for them. If there's one thing I want you to remember from this entire video, it's this. GDV is a race against time, and you are the first responder. You don't need to diagnose it perfectly, you just need to recognize the pattern. A large breed dog who's restless, retching with nothing coming up, and developing a firm, swollen belly, and get them to an emergency vet immediately, without waiting to see if it improves. That single decision, made quickly, is very often what saves a life. If you have a large or giant breed dog, talk to your veterinarian at your next visit about your dog's individual risk factors and whether a preventive gastropexy makes sense for them. It's a conversation that takes 5 minutes and could spare you and your dog from ever facing this emergency at all. If this video helped you understand GDV, please share it with another large breed dog owner. This is genuinely the kind of information that saves lives when people have it before they need it, not after. Subscribe for more evidence-based pet health content, and I'll see you in the next one. I'm Dr. Ethan Lee. Take care of your best friend.